Hello, I'm Peter Tufano, the Dean of Said Business School at the University of Oxford. Welcome to this latest in a series of conversations and events called Leadership in Extraordinary Times. When the pandemic kicked off, we decided that it was important for us to join together as a community and a global community to understand what was going on, to hear from some of our leading academics about the research that we're doing and how it bears upon the issue of COVID and the associated humanitarian crisis, economic crisis, political crises that it's wrought. But we also spend time hearing from leaders at the front, business leaders, women and men who are kind of in the face of COVID and also trying to understand the implications for it for business and broader society. As some of you may know, this school has a particular and special commitment to Africa. Africans make up less than 2% of the MBAs around the world. And if you go to any of the leading business schools, other leading business schools, you'll find an extraordinarily small fraction of Africans in their class. And some years ago, I publicly committed in Abuja, Nigeria, that our class, that our students would have at least 10% of our class from Africa. While this was greeted with some degree of skepticism, this year I'm proud to say that 13% of our MBA class comes from Africa. It's more than that. In our 1+1 program, where we combine the MBA with other degrees, you'll find that one of the great combinations is between our MBA and the MSc in African Studies. We run, or have run until this year, a major African business forum, and we will again when we're physically back in business. We routinely bring speakers from Africa to the school, including heads of state. We have a strategy of embeddedness in the university, and one of my dearest partners in this strategy is Professor Wale Adebanwi, the director of the African Studies Center. My wife and I have personally committed to fund a student from Africa each year. And you might ask why. Is this a publicity stunt? Is this political correctness? And the answer is absolutely not. We've said for the last 9 years that we seek to tackle world scale problems. And our community has affirmed that over the last year. We've gone back to all of our various stakeholders. And each one has told us that it's important that we as a school not only do excellent teaching and research, but we use the convening power and more of Oxford in order to try to directly address the issues of the world. And how can we do that by ignoring more than 15% of the world's population, the way that other business schools do? How can we do that by just paying lip service to the region of the world that will see, in fact, the greatest growth in population? We can't. So the strategy that we have is very clear. We are committed to Africa, all things Africa. But let's talk about what that means. Is this just another neo-colonialist approach where, the folks from Oxford say that we have all the right answers? And the answer is absolutely not. We're engaging with Africa, African leaders, young and old, because we have so much to learn from its young people and to learn from its experienced business leaders. And today I'm so excited to continue to learn from Ibrahim, one of the clearest thinkers about governance and leadership on the continent. I was proud to meet Dr. Ibrahim at our first Africa Business Forum, where he was the keynote speaker. And he gave a rousing, clear, and no-holds-barred talk at the time. And then I had the privilege of attending one of his forums to read his work and to see the work of the Ibrahim Index on African Government. He's not only one of the clearest thinkers about governance and leadership in Africa, but he's also someone who has never hesitated to speak truth to power. We're thrilled to have him back with us in this broadcast, and I hope that we'll find even more ways to work with him today. Interviewing Mr. Ibrahim today is Professor Wale Adebanwi, the director of the African Studies Center at Oxford. Wale is a political scientist and anthropologist. His research and teaching focuses on the processes of social mobilization of interests and of power. Wale and Mo will be in conversation for about 30 minutes, and then we'll be joined by two of our outstanding students asking questions. And then we're going to be over to you for your questions. So please do send your questions to us. We already have a number of them that have come in, and I'll be moderating the end of this session. Now it's over to Wale and to Mo for this first part of the session. Thank you both.
Thank you very much, Professor Tufano. It's a pleasure to interview Dr. Mo Ibrahim, who I've admired for several years, especially for your leadership prize in Africa. I'm hoping I'll be a leader someday and win the prize. So let me start by asking about the Mo Ibrahim Foundation report on COVID-19, which I have read. How can the recommendations be transformed into action by African governments and their international partners?
Hi, Wale. Thanks for having me, and my thanks also for Peter for inviting me again. Well, I mean, what we're trying to do in the foundation is to try to collect data and present a realistic picture of what's going on, and we suggest policy and actions, etc. And in COVID, actually, I'm very pleased to say that the African leaders did, most of them actually, did rise to the challenge. Uh, they came together early on. They imposed some tough measures in their communities. Uh, it is really was wonderful to see uh, people acting and showing leadership at this time of crisis. We had the advantage of a little bit of window before the wave of the infections came to Africa, but people used that effectively. I mean, in Europe and US, they had a window to act, and we all see what happens. So that was good. Dealing with Africa, with COVID in Africa, was a major problem because uh, we could, imposing social distancing, locking people up, when the informal economy is a dominant, is so wide, and people earn their living daily. Now you lock them up, they die of hunger. Uh, African countries and governments don't have the fiscal space, which other countries like UK or US or Germany or whoever, what they told us, they said, stay at home, I'm going to send you your salary, and pick up your phone, order food, delivery, wine, whatever you want. You know, you really have sort of a holiday, paid holiday at home with your family. Uh, of course, some people have nice big homes, some people have very little tiny apartments, and so inequality was obvious there, but at least there was financial support, etc. We don't have that physical space in Africa. We cannot support citizens or businesses. Billions of dollars have been and pounds have been allocated to help businesses, etc. So it was tough for Africa. Uh, but somehow, for some reason, uh, so far the infections have not really been that high. The infection rate has not been high. Will there be a tsunami later on? I mean, some people predict that it will hit us hard later on. I note that the number of infections are rising. I mean, yesterday it was touched 400,000. Uh, just a few days ago, it was 300,000. So it really increased quite a bit. But still now, these numbers are very small compared to what's happening elsewhere. I pray and I hope that that's it. We don't have a major wave coming across our shores. Of course, as usual, there will be some uh, of African leaders. There will be some mavericks who, will not follow scientific advice or whatever. I mean, we see some leaders in the middle of the pandemic inviting people to go to churches to pray because you know. Uh, this is punishment from God, and if you pray, we're gonna sort it out, uh, and neglecting to take any other measures or whatever. We see people who totally ignored any advice, and at least one leader paid with our own life for not recognizing what is going on. But the majority of African leaders did really take reasonable action. They came together and they built bridges, especially with Europe. And we saw the call for action by which was signed up by a number of African leaders and 9 European leaders, which was a wonderful step forward. So far, Africa, I think we can tick the box and we say, well, they behaved this time reasonably.
So what about some of the other proposals in terms of going forward? How do you think they can take these proposals on and actually use these proposals in responding to the consequences of the pandemic?
Right. I think one of the obvious things we need to do, not only in Africa, everywhere, is to pay attention to the public health. Public health is an essential public good. Governance is about delivery of public goods. And in many of our countries, I mean, the share of the health services in the national pie is very small, very little. And we need to really to build resilience in our system. And this is not only in Africa, this across the board. And the performance of many countries reflected that. Well, you know, what's the difference between Germany and UK? It's, I think, 2 differences. Much better organized health service and, of course, much better leadership. And you can see the result, what happened here and what happened there. So people paying with their lives for incompetence and bad policies. And they're going to be a reckoning because there have to be inquiries everywhere to evaluate what each government did with their people. But I think that one thing is important. The second one, strikingly, really, is the lack of coming together as an international community to deal with what essentially is a global issue. We see a lot of nationalism, and I corner the market on masks and ventilators. I ban my companies from selling stuff elsewhere. That's unfortunate. And I hope there'll be a good discussion post-COVID about what's happening to the international order. Why are we fracturing? Why we are, at a time when we need to come together? We have global threats, whether it's climate, whether it is pandemics, and we can only deal with this as a global community. We have to act. We cannot deal with climate, individually in Russia. We can help, but the action has to be global. So the same for pandemic. This virus doesn't know borders or passport controls, or it doesn't recognize that stuff. So we really need to deal with it in the most suitable way. One issue I think the pandemic also highlighted in Africa is to pay attention to the food security and the supply chains and how that was disrupted during the lockdowns. And I think people now are going to pay more attention to that. You need to build the resilience in our agricultural sector and the supply links over there, because that's one area which was absolutely clear. Well, we hope anyway that we can end up also some form of cooperation when it comes to the vaccines, or because a lot of issues there are going to fight over the limited supply of if we found a vaccine. Already we see some issues with some suggested medicines. I was watching a report yesterday about one of the two medicines who seem to do some good to the patients. One of them is an American company, which now is banned from selling that everywhere except in the United States. So again, we see the display of, I wouldn't say just nationalism, it's chauvinism actually. And I, I don't know. There's a lack of this humanity, and we're in this for together. But in the US, of course, it's an election year, and people are playing to the domestic galleries. Anyway, that's a long answer to your question. I'm sorry.
Thank you. Yes. Can I pick up on the question of food security and agriculture that you raised, to talk more or perhaps briefly on the economic impact of the pandemic? When you think about your campaign in terms of putting governance at the center of Africa's development, do you think this campaign is useful and critical in this moment?
Well, how to answer this question. This pandemic, of course, is an issue for us, but it's not the only issue. I think at the moment, more people die in Africa from malaria, probably, than from COVID. And but then all resources goes to COVID, and we do nothing about the people dying from all other diseases or other issues. And that, by the way, happens in other countries as well. We need to have a balanced approach to these issues. How it is an issue of consequences and how you arrange your priorities, especially if you have limited resources. Am I dealing with your question, or I branched away?
That's it. That you are dealing with it, yes.
Okay.
So yes, because I'm just wondering how you think the issue of governance is central, both particularly to the question of the pandemic, but also to other issues which you raised, several other health challenges that existed prior to the COVID-19 pandemic. So how do you think that the issue of governance is central or relevant in addressing these questions?
Absolutely, absolutely. Because governance as I said, about delivery of public goods. Of course, health is one of these public goods need to be delivered, but also need to deliver equitably. I mean, we need to take care of all health problems we have. And Africa has a lot of health issues. People are still dying of AIDS. People dying of other issues. We need to pay attention to that as well. There is health. There is a food security. Now, food security also is not only disrupted by COVID. It's also disrupted by the locust attack in East Africa. Millions of people are going to face hunger because of the devastation of crops in East Africa. So there is a number of issues. You need to balance your act. You need to see how the delivery of A is necessary for delivery of B, and then C, etc. So it brings us back to what we always said: governance is central. Good governance is central for the proper reaction. And we don't have the time. I can give you a lot of examples. I mean, Said is a British school. I mean, I think to study what happened in UK during the pandemic will be the best course you can deliver on governance or lack of it, to see all the unnecessary, stupid things which have happened in this country. But I mean, we hope we learn from that. It is not to name and shame, but to learn and see what we should do.
Yes. Finally, against the backdrop of the Africa Leadership Prize, I'm wondering what you think is the most critical role of philanthropists in Africa today. Is it the long-term, challenges like the Leadership Prize? demonstrate in terms of long-term planning? Or do you think that what's most critical for African philanthropists at this point is, the health emergency, which is in this period of the pandemic?
Look, there are always going to be pandemics, okay? And Africa suffered from so many of these pandemics. After this one, there could be another one and another one. What we need to do is also to pay attention to the long-term solutions. So if you talk about philanthropy, I mean, philanthropy has many faces. I mean, you can focus your resources in sending food or sending masks or sending ventilators to where it is needed. It's fine. But what's going to happen in the next one? What's going to happen in the one after that? I believe that empowering us to have the right policies. Why do we need ventilators and facilities? Why we don't have enough beds anyway to deal with people? Why we're not paying attention to the health sector now? Why are not building resilience in that? Why are not building our statistical offices to have proper data to guide our policies? Why we're not paying for attention for agriculture in order to feed our people? I think these are central issues, and some philanthropists try to fill in the gaps. In our foundation, we're trying to address why we have these gaps in the first place. Let us try to make sure that our governance really govern well. We fight corruption, we fight bad policies, ethnic divisions, sexual division, all gender issues. We need to deal with all that in order to produce a healthy society and a proper government functions. The role of the prize is really to be at the center of the discussion, to highlight the important role of leadership and governance, because that's important. So we need to create or focus some attention. We need to create this discussion about governance and leadership. Prizes are always one way, because it generates, here we are talking about the prize, so I have the chance to talk about link between prize and governance and leadership, because that we want Africans to focus on. We need better leadership, we need better governance. We are not happy with what is there. Let us improve it, because that's for everybody's benefit. So some philanthropists, we consider ourselves not philanthropists, we consider ourselves activists. And we think that can help changing things in the long term, instead of piecemealing, which is it's nice. We need the aspirins, we need the paracetamols to ease the pain, but doesn't deal with cancer. Cancer needs surgical operation, radiation, whatever. We need to deal with the source of the problem.
Thank you very much. Just before we move to questions from the audience,
Sure.
ask, how difficult is it for a billionaire to shelter in place in the last few months? I'm asking how difficult has it been for you, for a billionaire to shelter in place?
How do I?
How difficult or easy was it for you in the last few months to?
It was very easy. It was very easy because I'm well off. This COVID shown is the issue of inequality. If you are well off, you have no problem. You have a big house, you have a garden, you enjoy yourself with your friends and your family, there's no problem. If you are poor, you have a lot of problems, and it is shameful.
Okay. Thank you very much, Dr. Ibrahim.
Apartments, Black Council, apartments with so many kids and fighting over the one computer they have. The kids want to to connect with the school to get the education, and the wife trying to connect with her work to do something. Just think of the atmosphere of those people locked up in that space with no fresh air, with no ability. It's terrible. Okay. On the other hand, we have the will of people, and it's a family holiday. So it is. I feel guilty, but it is a problem.
Thank you very much. We'll now go to questions from the audience. We'll start with two questions from our students. The first will be Adil Gal. Adil is an MSc student in African Studies at the Oxford University. She graduated with high distinction from Victoria College at the University of Toronto, where she double majored in African Studies and Political Science. As a Queen Elizabeth II Diamond Jubilee Scholar, Adil contributed educational programming to the House of Children's School in Gisenyi in Rwanda. So we'll start the first question from Adil. Please go ahead, Adil.
Hello. I know you, Dr. Ibrahim, are signatory to a declaration calling for the COVID-19 vaccine to become a global common good. What do you think will be the main barriers to achieving this goal, and how can we strategize around these challenges?
I think the main problem, of course, is xenophobia and country chauvinism, etc. We've seen examples of that before. If you recall, early on, a plane carrying some equipment for medical staff in its way to Germany, Berlin paid for it, and it was stopped in Thailand in order to take this back to United States. It's an American company, and this that was really sad. There is a danger here that similar behavior can happen. Yesterday, I think, or the day before, there was a program about the BBC about the two medicines who proved to have some effect on the patients, and one of them, which happened to be an American, is not available because the Americans said no, we keep all that for us. That attitude by the US so far is not helpful, and but that's why we can see other initiative now in Europe with the WHO. Some 8 billion was raised, etc., to ensure that the vaccine is a global good. So we hope that people who believe in our global interconnection and will help mitigate that effect. The German government intervened a few days ago to stop a vaccine developer from being bought by the Americans because they said, well, we lose access. So we're going to see a number of this action between the states. I don't know if some other states also in the future we're going to behave like the United States. I don't know. But we have seen examples already, 2 or 3 examples where that happened. And it is a real fear, really. But I trust there are going to be enough wise leaders and around the world who will stand up and ensure that enough resources are made available for a global good. Even Chinese promised that it's going to be a global good, but I wait to see if that was just nice words or true. Anyway, we'll wait and see.
Thank you.
Thank you. I'll call Peter now.
Great. So our next student questioner is Dr. Diana Wangari, who's on our outstanding Oxford MBA program. For those of you who don't know our program, it's a 1-year program, and we have students from all over the world, and Diana is one of those. She's the CEO and co-founder of Checkups Medical Centers, which utilizes in-house developed technologies to provide access to rapid diagnostics, consultation, and last-mile drug distribution through its delivery services in rural and urban areas. She plans to use her MBA to support her vision to scale Checkup's medical center to 25 sites in the East Africa region in the next 5 years. Her venture could create over 300 jobs, provide access to medicines and diagnostics at 30 to 40% below market rates, which are high in Africa, to drive universal healthcare through private sector strategies.
This is wonderful. Is she from Kenya?
Yes.
Are you Kenyan?
Yes, I'm Kenyan.
You guys are the best entrepreneurs in Africa.
Thank
Really? Wonderful.
Thank you for that. And thank you for your time, Dr. Ibrahim.
You're welcome.
I believe that African leaders face a very unique challenge in that there are many other healthcare and societal challenges across the continent. For example, in Kenya, we have 6,500 coronavirus cases, yet we have millions more who are suffering from life-threatening conditions, malaria, TB, HIV, and AIDS. And many of these patients currently, and for lack of a better word, are neglected, right? Because we're focused on managing the pandemic and the outbreak, but this is not sustainable. So my question is, how should African leaders prioritize their country's healthcare needs in this pandemic to meet the demands of the outbreak, but at the same time service the ongoing healthcare needs of the population?
That is a wonderful question. And it should not be just directed at the African leaders. It is a global question. Let me tell you a personal story. My elder brother, unfortunately, developed a serious cancer. And he came to UK for treatment, and it's an advanced stage. And he was hospitalized, of course, in a private hospital because he's not a UK citizen. And I had some operations, etc. Then they said, "Oh, you must come and take him from the hospital." Why? Oh, because National Health Service now is taking control of all private hospitals, and they're gonna send their patients, and they are COVID, possibly, COVID patients, and your brother is at a critical stage, and he's at risk of COVID, so you must take him home. This guy is in emergency treatment. Oh, you have to create environment for his home. We have to get all kind of equipment. We have to get nurses and get there 24 hours and to move him out. And I think, well, at least we managed to have a space. We managed to buy all this stuff and create a mini hospital at my home. What about other people? And cancer is a terrible disease. What happened to all cancer patients in UK? Were kicked out, were not treated because of COVID. And how many people died as a result of that? Nobody knows. What about the homes in UK? It's a huge scandal. People were dying like flies there because they just forget about that. And we just focusing on protecting the NHS. Protecting NHS means deaths of other people, whether it was cancer or whether in elderly in homes or whatever. So it is all about poor judgment of leaders who cannot see the wood, from the trees sometime. Unfortunately, people need to have a balanced view. What happens is that I think leadership panicked. They suddenly found the pandemic, they cannot handle it, and they look bad, and they make all kind of stupid decisions, which still they are making up to today. So this is not uniquely African problem. It is a problem of leadership all over the place. You look at the American president, how is the guy refused to wear masks. What do you say? So there is, unfortunately, that problem we have worldwide with this kind. So I'm really glad you raised that question. I just want to change African to world because everybody is facing with the same problems, and some of our leaders, unfortunately, are making the wrong choices and wrong decisions. Thank you for a very, very good question.
Thank you.
Thank you, Diana. And so we have listeners from the Americas. We have listeners from across Europe. We have listeners from Asia, Middle East, and of course from Africa. And I have the enviable task of going through far too many questions and trying to pick out a few that we can answer. So Dr. Ibrahim, these will be wide-ranging. Let's start with this one from Kingdom in South Africa. There's a debt problem within Africa's private sector, not just its public sector. Which organizations, if any, should be stepping in to bail out or support companies?
That is a wonderful question. From the outset, we have been arguing that the problem really going to face Africa is not a health problem; it's going to be an economic problem. That is going to be massive for us. African economies are going to go into recession. We are not selling our mineral stuff, and actually, tourism died, hotels died. It's a lot of activities are in severe. Now, G20 met some few weeks ago, or a few months ago, and said, okay, we're going to postpone, defer the interest payment on public debt to the end of the year. Oh, thank you very much. But Africa debt is 44 billion, and this public debt is about 12 billion or some close number to that. What's happening to the rest that has not been dealt with? And then the other question is, okay, that is about public debt. What about private debt? How are we going to help the African business? And a number of proposals are being made. I mean, we have been in discussion. I mean, our sister in UNECA, Vera Song, she published a good op-ed in the Financial Times 3 days ago or something, with some reasonable proposals. Also, we have Tijani Siam, who's trying to work also some proposal. The African Union agreed to appoint some 4 or 5 people to be champions for Africa outside, that including Tijani Siam, because he's also banking experience. He was suggesting also creating of something like a bad bank where the debt can be put there, etc. Vera was suggesting also to, if you can try to create vehicles which can some money injected in it from whether the multilateral or some of the donors companies, and then we enable countries to borrow from that vehicle, which will have a higher rating than the sovereign debt of Africa, to minimize the debt, etc. And in return, they'll be able to help their own private sector. So there is a number of proposals at the table. Nothing has materialized so far. The private sector in Africa is really suffering, and states unable to help. They don't have the fiscal space. It's not a question of willing, but they don't have the ability to help the private sector. It is a problem. And unfortunately, we have some proposals, but in reality, we don't have the beef yet. So it is a worrying situation.
Right. Thank you for that. And for those of you who are finance experts, what a problem to put our collective attention to about having to solve this debt crisis in Africa. Next question comes from Osman, who's an incoming MBA student from Nigeria. And for those of you who are incoming students, we are very much looking forward to welcome you in person in September. The question is this: how can the private sector enhance good governance instead of seeking to take advantage of bad governance?
That is an interesting question. Well, we hope that the private sector start first by improving corporate governance. That's, start with yourself first. A lot of problems we have is because of bad corporate governance. And I belong to a group called the B team, B as letter B, and the number of CEOs from across the world, a lot of very senior people. And yesterday was having our sort of retreat, video retreat meetings, and we're focusing on the issue of how to improve corporate governance. And for us, I think business ought to be part of the solution, not part of the problem. And we need to start with the various issues, and we start with ourselves before stand on our soapbox and lecture everybody, etc. We look at ourselves first. What are we doing with issues like climate? Are we addressing our own carbon footprint in our business and our supply chain? What we're doing about that is a problem. Very important for our future. Resilience of business is important, is at stake here. Then gender issues. How, human rights issues. Do we protect human rights? Then taxation. Do we pay our fair tax? Or are we smuggling? So start with your, if you do well in your organization, demonstrate that you have moral values. You look at your boards. You have a diversity. We're having this discussion, Peter, yes, because most of our CEOs are from the United States, actually, like vast majorities, and also Western Europe. And we're taking the issue of the diversity in the board. How many African Americans are on the board of American companies? Mm-hmm. What is, the recent event in US have raised this question now about race, etc. And we need to face that. We cannot just push it, under the carpet. We have been pushing that under the carpet since the Civil War in the United States. We have never faced our problem. We put up museum for genocide, and I asked people, where was the museum for slavery? You guys in America did not kill the Jews. I mean, the Germans killed the Jews. So the Germans should atone for their crime. Why are you trying to do something for the crime of some other people? Do something about your own crime. You started your country with genocide against the Indians. Then you went into slavery. You need to stand up and face it and deal with it. Germany went through denazification. Have we went through a similar process in the United States? So anyway, we moved into wider issues, but I think business has a role to play really in dealing with all these issues. So we are really fighting for better governance in business. So please, for our business people, start with yourself before you try to go and improve governance in public governance, because actually public governance probably is better than your governance in your own company. So let us be honest.
I think that's a great answer. It's not only true for business, but business schools too. We have to play our role in this. So we have a number of questions that are on the opportunity side. So let me try two. I'll read two. One from Emma in Kenya. She says, where do you feel the investment opportunities are in Africa, especially post-COVID-19? And then from, there's another one here from Yuki from Zimbabwe, who's a current MBA student. What opportunities are there for African businesses in this crisis? What kind of businesses in particular? And what will it take to realize these opportunities? So both Emma and Yuki are asking, what are the opportunities that you see right now?
Well, I think the opportunities are clear for everybody. Look what you have been doing through the lockup. Our kids have been educated over whatever platforms. So a big winner will be education online, clearly, because for the first time we experienced, every family experienced what is education online. Your own school, Peter, started to do a lot of things online now because you are forced to do that. And then people finally said, actually, this can work. So I see that as a growth, huge market, especially in Africa, because we will have the ability now to deliver high quality education online. You know, we don't have maybe great professors in our villages, our small towns. We don't have great, but we can have all great professors online, and it's different. So it's clearly education will be a great success. We see also things like all services delivered over line, online, I think is gonna grow because you experience that. I ordered my food for 3 months online. I stopped going to supermarkets and stuff like that. And actually, guess what? Oh, I saved in energy, I saved in carbon footprint, and I saved my time. And what's a great service? So we're discovering that how important. Then look at people working from home now. You know, we all discovered that actually, you know what, we can work from home and we can be productive. That will minimize the number of time we need to spend in the office. That's going to change, produce a whole change in the where we live, on our transport system, etc. And suddenly we discover that the broadband maybe is more important than roads. That will change also our mindset. I think if you look at what we have all experienced over the last 3 months, you'll find the answer to your question. These are the winners, the people who delivered for us all these services. And we all got acquainted with it and we loved it. That's what I think will be the winners.
Okay, let me pick up exactly from that. I have a question from Thomas Hellman, Professor Thomas Hellman, who's Professor of Entrepreneurship and Innovation at Oxford Said. And I'm so thrilled that our students watch this, our accepted students watch this, guests from all over the world, but our professors are watching too. And Thomas notes, is Africa ready for growing its own high-tech Silicon Valley? I know there's Silicon Savannah. What will it look like and where? So these businesses you talk about, some of these will be in fact very tech-enabled. So how do you see the development of tech across the continent or in clusters in the continent?
I think it will happen. It will take time, but it will happen because this new technology is a great enabler. You don't need huge amount of infrastructure or capital in order to develop and innovate. And it's interesting. First time we saw people 3D printing ventilators in some African countries. Mm-hmm. I would have never imagined that 3D printing in Africa. People are able to produce something so sophisticated. I heard about a lab in Senegal 3 months ago. Before, early on, they used their expertise with dealing with Ebola and developed a test for COVID, which cost $1. I could not believe that. That is really very interesting. Need, of course, generate also the will to do something about it. Yes, I think we are in a good place to start to see this development of business parks. We cannot create really Silicon Valley. Also, have to remember is not just about developers or who are actually most of them are foreigners anyway. North America. I visit some companies there, and it's interesting. But capital, venture capital, just next door to them, they have these trillions of dollars sitting there looking for return, and those guys are next door. That helped a lot. One of our problems in Africa is the lack of really venture capital and angel investors. Without angel investors, would we have Microsoft? I mean, a guy developing something in the garage, who would fund him? An angel investor. And that's what made Bill Gates. If he didn't find this funding, he would probably end up taking a job in the civil service or somewhere. We didn't have Microsoft. So that is something we need to look for also in Africa. How can we, or I don't know. What can we do about it? How can we find angel investor? How can we have that ecosystem where we pay attention and we're happy to take risk with the local guys doing this and that? That, from my view, is the main impediment. It is not the lack of intelligence or ability or even resources. It's the lack of resources, lack of financial resources to help the early stages.
Great. So, and that's, it's heartening to hear you say that, because a number of our alums have gone on to do finance, private equity, and venture capital across Africa. And for those of you who are out there, there's a big business out there for you to do. If we were doing this, 6 to 9 months ago, there's no way that we would have gotten 50 minutes in and not talked about direct investment by China and by the West. And so a question from Kurt Saunders: what's the future role for the West in respect to continuing to provide aid? Has it achieved real change in the lives of ordinary Africans? China has stepped in with money, business, and control of resources by using the pressures of debt. What's your view on these issues?
Well, I mean, that's a difficult question, but let me say, I mean, the fact is, China and Africa, China is taking sucking all the air, the headline about investing in Africa or whatever. The fact is, actually, Europe invests much more in Africa than China. I mean, this is a fact. The real partner for Africa is Europe, is not China. Although there is all these headlines about China, etc. One thing I like about Europe, although the many past sins, is that there is increasingly more attention is paid to governance, to really play by the book. And I was actually in a meeting yesterday. We have this group meeting between Africans and Europeans and the European Union to try to deal with the issues between Europe and Africa. And we had a number of commissioners and number of African leaders, not government. This is non-governmental, but past presidents and various African economists and thinkers. And we were discussing actually the interaction between the two sides and how to improve the relationship. And what really I liked or admired was the clear position of the European Union now, and we need to reset the relationship. We need to have a partnership. We are not trying to tell the Africans what to do. Okay, together we need to work out what is the best. But best solutions, which does not meet demand, is useless. We need to understand what's the demand. What is it? So best supply must meet demand, and we need to really work this out. So there is a great will to now engage in a positive manner. And what also clear is Europe is clear now about engaging not just with the African Union as in the past, but with the youth, African youth. The day before, there was a big meeting between African young people and European young people with people from the Commission. I was in that call as well, and a discussion between young people. So it's important to include, because 60% of African people are young, below 25. So we say to European, you want to build a relationship with African leaders, with the African Union, or the African people? With whom? Actually, you need to build a relation with all of them. You need to build a relation with the business. You need to build, so that is really important. In the past, the relationship was mainly between the African Union and the European Union. And it was a mismatch because we said to them, actually, you know what? You are not mirror organizations. The African Union is really a club for the executive club for the African presidents, but there is no executive power being delegated No sovereignty has been delegated. When the African Union make a decision, it doesn't mean any member has to implement it. It's selected, you choose if you want to elect it or not. It's different. The Commission in African Union has real power. European countries delegated a lot of authority in many areas to that body. When they commit on anything, it's not every European country must do it. So, every European country, but that's not the question. So, European negotiators sit with a negotiator from the African Union, you shake hand, European guy goes home, say, we have a deal. Sorry, you don't have a deal. That deal has to be ratified individually by 54 countries and parliaments and people, and everyone has a different agenda. That is different. China is different relationship. China is a government. It doesn't deal with civil society. We, in our foundation, we fail to communicate with China because it's time to say, who are you? Are you government? No, we're not the government, we're people. And they say, sorry, we only deal with government. And we say, excuse me, you call yourself the People's Republic of China. Where are the people in the People's Republic of China? There's only the government and the People's Republic of China. It doesn't work. You guys need to talk to people. So we cannot do, so that create unhealthy environment of the possibility of opaque deals. Things signed, we don't know what is being signed. We don't know what is being given. Give me a mineral, I build few roads and some hospitals for you. Exactly how many hospitals, what quality, transparency. With China's deals with Africa, unfortunately, lack transparency in most of the cases. That is not acceptable. And that will come back and bite them in the ass. We have to realize that. You cannot do dodgy stuff here and there, and you think that will last. We can see a lot of issues in railways, lines, etc. Having said that, China is an important partner, also trading partner with Africa. We need to deal with China, and we sell a lot of commodities to China. It's just we need to have a proper, transparent deals with our customers, with our suppliers. That is very important.
Great. So, well, we only have a couple of minutes left, so I want to combine a couple of questions together, and they're both about mindsets. How do we change the mindset of people in Africa with respect to governance and other things? How do we change the mindset of people outside of Africa about the potential for Africa? So, you more than anybody else have been kind of advancing these notions, but how do we change the way that people think, both about their own potential and about the potential of this amazing continent?
I think it is hard work, Peter, and we need to do it. We need to show example. Yes, we have our faults in Africa, but we're not that bad. Many African countries actually are run quite. One of the things we do is this data we publish all the time and shows here is what we're doing, guys. We're not hiding anything. Judge us by what we're doing. Perceptions take time to die, unfortunately. And still, many people quote to me Idi Amin, quote to me Mobutu, I said, excuse me, those guys died 40 years ago. Why you keep quoting this to me? How do you feel as a Western if I keep quoting Hitler and Mussolini to you? You had those guys. And, but we never throw it in your face and say, you are guys terrible, because you had, everybody had their bad leaders, had their bad deeds in the past. Judge us with what you're doing today and let us build this relationship. Young people, Peter, also travel a lot and they go online. I think the new generation coming up also has more access to information, to friends, to acts. They are more aware of what's happening around the world than our older generation who really doesn't have the same. So I'm hopeful. It's going to take time. It's going to happen. And we will fall in love again with each other.
Well, I'm hopeful too. And, the thing that makes me most hopeful are two things. One is these amazing young people that we've seen today, Dana and Adele being representatives of them. and also leaders like you, Mo. It's just your leadership, not just as a business person, but then you got engaged in the public sphere and through your foundation. So I want to thank you for not only joining us today, but for the leadership you've shown to the world and for the example that you've shown.
Thank you for having me, and thank you for what you're doing. And I love the fact you have 13% of your students from Africa. That is a badge of honor. Thank you.
Thank you. And thank you all. Thanks for joining. Wale, thank you especially for joining us today. And I'd like to welcome everyone back next week. On Tuesday, we're going to discuss marketing leaders, crisis management, and the future of growth plans. And certainly marketing is on the hot bird seat these days with a number of other issues. And on Thursday, we're going to discuss the reshaping of the mergers and acquisitions market. There's no shortage of issues in the world that need our attention, whether they're in Africa or in the UK or anywhere. And I hope that you feel supported in these extraordinary times by Oxford Said and the series Leadership in Extraordinary Times. Thank you all. Have a great day and do good work.
And thanks, Wale, for
Thank you.
good discussion. Thank you.
Thank you, Mo. Thank you.
Bye-bye. Thank you.